Hello everyone, it's Dr. Gupta at the Dermatology Laser and Vein Center, and here I'm showing you a procedure to help with under eye bags. So under eye bags can be removed either by surgery, doing a blepharoplasty, where I would make an incision either on the inside part of the conjunctiva, where you would not see a scar, or just at the external lash line to access the fat pockets and remove them. Now in this case, we're just making a little needle puncture on the side of the skin, and I'm using a device called Accutite that has a slim probe that goes under the skin. It is a blunt cannula, and it delivers radiofrequency energy right under the skin. And this helps to do two things. One, it helps to break up the fat cells, and we can actually hear the fat cells kind of popping and crackling as they're dying off. And then it also stimulates new collagen production and helps to tighten the connective tissue in this under the skin. So we can get some very nice results without having to go through surgery using the Accutite procedure. Accutite is part of a bunch of procedures called also BodyTite, where the probe is a little larger and we can use it on body areas, and then also called FaceTite, where we can use it actually on the neck and the jowls to accomplish the same thing. I also like to use this Accutite probe to get a upper brow lift, where I can use it in the forehead and get the brows to actually lift up nicely, or even the upper eyelid. But in this case, we're using it right under the eyes. You can see the patient is extremely comfortable. In fact, she's asleep for this procedure, and we did not give her any anesthetics, just a local numbing agent, and that's it. And patients can actually even drive home afterwards. Of course, there is going to be some swelling, potentially some bruising with the procedure. The swelling can last sometimes a week or two from what we've seen. But this way there is no scarring, and some patients just really prefer not having cutting or a surgery kind of procedure. Now in this particular patient, I also decided to do something called Morpheus 8. So here is the Morpheus 8, or actually the Morpheus Prime tip that I'm using, which has 12 pins that come out of the device, and they quickly run into the skin, and then they deliver radiofrequency energy deep under the tissue, and we can set the depth of the needles to anywhere from 1 to 4 millimeters deep into the skin, and then also control the amount of energy that is coming out with each pulse. We can also make multiple pulses at one time, or the probe can stay under the skin and deliver a few pulses at a time. Normally I will treat at different depths under the skin to get the best results. And again, this can also be used anywhere else on the body, including we've seen some really nice results on abdominal tightening using the Morpheus 8 procedure. And in this case, like I said, we're using the Morpheus Prime tip, which is just a little smaller and just a great little adjunct tool to use for the under eye area. It can also be used independently without the Accutite having been performed in certain cases. This is really great because the patient is already numb, so she can't feel anything. She's actually fast asleep, and we're just delivering doses of radiofrequency energy under the skin to achieve a little bit of extra tightening. Not much downtime again with this. The needle punctures are very tiny, so there's really hardly any healing. We do recommend just placing a little Aquaphor ointment or Vaseline for 24 hours or so, and then the little puncture should be closed, and one can go back to using their normal skincare products. So that's a little bit about Accutite, and also looking at the Morpheus procedure. Please like, comment, and share on our posts, and keep watching our videos. Thank you so much.